distinguished ranking member of our committee, Mr. Jordan.
Mr. Chairman, thank you. I know you care passionately about this, and we appreciate that, the commitment to dealing with this crisis. And this is one of the most trying issues of our time. This committee has rightfully treated the ongoing epidemic as an issue of the utmost importance. Chairman Cummings and I both represent states that have been severely affected, and the situation, as the Chairman described, is nothing short of heartbreaking. Our home state of Ohio has the second worst opioid overdose death rate in the country. In Ohio, more people die from overdoses than from car accidents. Over the course of a single year, Ohio has witnessed almost 5,000 fatal drug overdoses. That's nearly 14 deaths every single day. As all too many of you know, this staggering death toll does not begin to capture the devastation inflicted on families and communities. Today, we will discuss the sad fact that many Americans suffering with addiction are not able to access evidence-based treatment options. We have witnesses here today who will help us understand the extent of this problem and how we can get to the solution. And I appreciate you all being here and look forward to hearing what you have to say. This is an issue deserving of Congress's attention, and I'm pleased that this committee has made it a priority. I'm also encouraged the Trump administration is fully committed to addressing the problem. As we have heard during 2 recent hearings with the Office of National Drug Control Policy, the administration has a plan to reduce opioid demand, cut off the flow of illicit drugs, and save lives by increasing access to treatment. The plan is producing results. Since President Trump took office, there's been a 34% decrease in the total amount of opioids that pharmacies dispense monthly. Also, the number of patients receiving a form of medication-assisted treatment has increased dramatically. Monthly prescribing of life-saving Naloxone, as the Chairman talked about, has increased 484%. The Trump administration has invested $500 million in the HEAL initiative to bring new non-addictive pain management therapies to patients in need. And this administration is making great strides to enforce parity rules so more insurers are providing the services that their members are entitled to. Last year, President Trump signed into law legislation that allocates $6 billion specifically dedicated to combating the crisis. This crisis does not strike each community in the same way. What prevention and treatment efforts may be effective in one area may not work as well in another. What we know for sure is that this is not a problem that funding alone can solve. We need to thoughtfully empower communities to address their unique needs to reduce the supply of drugs, prevent drug use, and provide access to needed treatment. It would also be a mistake not to address one of the root causes of the opioid crisis. We should consider securing our borders a necessary part of this effort to deal with this problem. Earlier this year, enough fentanyl was seized in one drug bust, in one seizure, enough fentanyl to kill 57 million people. It's scary to think of how much is getting through. I'm grateful for medical professionals who are with us this morning. You are on the front lines battling this problem daily. Thank you. Thank you for taking the time to be here to discuss this health crisis. And I should just point out, too, that there are a number of important things going on this morning. This one is certainly one of them, but there's a reparations hearing next door. There's a former White House advisor upstairs in a deposition, and I'm supposed to be at all 3 places at the same time. So I will be in and out, but I do look forward to hearing from what you have to say. Other members will be in that same position.